My name's Carolyn Presley, and I'm a thoracic oncologist and a geriatric oncologist, so I specialize in caring for older adults with lung cancer. I'm very passionate about cancer research in older adults in particular because they are a vulnerable patient population. The fitness study focuses on older adults who either have lung cancer or blood cancer and really looking at their risk for toxicity from receiving treatment, whether it's with chemotherapy or immunotherapy. And we're looking at evaluating tools to try and predict who will experience toxicity or adverse events from getting cancer treatment, whether it's for a blood cancer or a lung cancer. And we're doing different assessments, we're using different tools because most studies don't include very many, less than 10% of older adults in the studies that lead to the approvals of new cancer drugs. So this is a real understudied group of patients. And so the whole goal of this study is to look at different measures like survey questions. So we're asking patients questions about just their everyday living. We're checking their balance, walking. We're also checking markers in their blood, and we're also looking at their microbiome in their stool. And we think that the bacteria living in your gut or perhaps markers in your blood may give us a lot more information, specifically in older adults, in how they will be able to tolerate or how their lung cancer will respond to these newer drugs. A lot of it is quality of life, I would say, but it's more than that. Routinely, we don't ask patients about sort of everyday living. Are you able to take care of yourself and do it in a way that really satisfies you so that you don't have to rely on other people? Because I think a lot of older adults really feel strongly about maintaining their independence. This study is really focused on what we call functional status and resiliency, being able to actually continue to maintain your independence even after treatment has started. We know that how old you are does not translate into how well you will necessarily do. I saw an 87-year-old recently who probably was better able to take care of himself than some of the 55-year-olds I've seen. We want to treat people as aggressively as we can to control or even sometimes cure their cancer. But what we don't want to do is really take away their independence and expose them to toxicities that we could potentially prevent. We absolutely think this research will be able to help not only patients with lung cancer and blood cancers, but other patients with other types of solid tumors. Pelotonia funding is really a critical source of funding. This project would not be happening without it. And it's really a unique opportunity to really push forward the science and personalizing care for older adults with cancer.